Today, I want to talk about doctor-patient relationship. When you go to see a doctor, it's not the same as buying something. It's much more than that. It involves trust between the two parties, personal responsibility for both, and ongoing maintenance. This relationship had not changed until about 50 years ago, due to the advancement of medical technology. Because of the advancement of medical technology, we saw the rise of drug companies, hospitals, and insurance companies. These are very big corporations which are profit-oriented. And we also saw government taking over the healthcare business in many other countries. So, with the result, the traditional relationship has changed a lot, but it still exists in some non-Western countries, especially in China, in the countryside, where you can still see the traditional doctor-patient relationship, because they are practicing a different kind of medicine, which is Chinese medicine. First of all, I like to talk about payment and price. In the old days, up to the 1950s, every patient pay out of pocket unless you have a very big operation or surgery that you may seek help from the government or from other sources. So when you pay with your own money, you don't overuse the service, and you also tend to negotiate the best price with the doctor. On the other side, the doctor can only charge what the patient can afford, because if the doctor charges too much, he will drive the patient out the door. Then he has no business. But when we have medical insurance companies acting as a middleman, it changes all that. With medical insurance, because the patient pays a fixed premium every month, the patient tends to overuse the service. It's just like an all-you-can-eat buffet. You pay a fixed price, you can get as much service as you want. And the doctor too, the doctor tends to charge the highest price that the insurance companies can permit. So in that case, both sides tend to, one side tend to overuse, the other side tend to overcharge. They don't negotiate the best price, they just give away this right to the middleman, the insurer. Now the insurer finally becomes the arbiter. He just decides on the price, and he fixes the price to maximize his profit. He doesn't regard the interests of the doctor and the patient. In healthcare, we got to think about quality as against quantity. What do we mean by quality healthcare service? Do you know that in the old days, up to the 1950s, doctors made house calls? And when you went to see a doctor in the old days, there was no insurance forms to fill out. Now the situation is completely changed. Even though we have all kinds of medical advancement, medical technology, they are very expensive, and only the rich can afford it. The poor people needs help. If you are rich, you have no problem. You can buy whatever expensive medical service you want. Now, quality means care and ethics on the part of the doctor. It also means self-responsibility on the part of the patient. The patient has to be responsible for his own health, for maintaining his own health. And it also requires cooperation between the two parties, so that the patient can achieve prevention and maintenance of good health. For the healthcare industry to achieve high quality, it must achieve both physical and mental wellness for the majority of the population, not for just the few who are rich. Now I want to talk about the problem of over-testing and over-prescription. This is a very acute problem occurring in the United States. It causes the runaway healthcare inflation. Because in the United States, we have a misguided pay system for doctors. Doctors are paid, in addition to their fixed salary, they are paid extra for the tests they order and the drugs they prescribe. So they have every incentive to prescribe more tests and drugs. That is why it results in both over-testing and drug prescription. This problem has been criticized for a long time. This has been happening for a long time in most of the country's hospitals, but there is one good model for the other hospitals to follow. This is the Mayo Clinic, which has drawn a lot of national attention. The Mayo Clinic is located in Rochester, Minnesota. They have a different pay scale. They use a fixed pay scale for doctor only and the staff. There is no extra pay if they order tests and drugs. So this has caused their expenses to be almost half of the national average. There's another problem that is even harder to fix, which is technical details and scare tactics. Health maintenance should be very simple and is not complicated at all if you use your common sense. Have you noticed that when you talk about healthcare out there, there is just too much technical jargons? People seem to be very happy in using technical words, technical jargons when they talk about healthcare. It doesn't help that much. It only makes the conversation more confusing. And because people seem to be so happy with the technical jargons, the healthcare providers will use this as a means to make money. So they will use more technical details to confuse you. And the worst thing that happens is that they may use scare tactics to scare you into buying their products and services. So this is a very unethical and immoral thing to do on the part of the healthcare providers.